Myself and Kathy Fan are going to talk for the next few minutes about corrective jaw surgery, or orthodontic treatment as it's perhaps more commonly known. So why do we do corrective jaw surgery? The main reason we do it is when there's malalignment of the jaws and the teeth, so that the patient has problems with their bite, as you can see on the left-hand side of this screen. And it's a treatment which involves firstly using fixed orthodontic braces to put the teeth into the ideal position, followed by corrective jaw surgery to put the jaws into the right position, and creating this image you can see on the right-hand side of the slide with the teeth in an ideal bite, with a nice smile, and with a nicely balanced facial appearance. So, what sorts of reasons do we do this for? Function is one of the most common reasons. If you look at the slide at the top, you'll see that the lady whose images you've just seen could only actually bite together on her back teeth. That makes biting and chewing really difficult. It means that even eating the most normal foods is difficult. You can't bite into an apple. You can't eat a sandwich without leaving all the filling spilling out. And an awful lot of the patients that come to see us talk about how embarrassing they find it, eating in social situations and thinking that people are judging them because of how they're eating. Then we have dental health problems. The way that the teeth bite together might actually be causing damage to the teeth or to the gums surrounding the teeth. And by doing something at a fairly early stage, it avoids quite often significant problems at a later stage in life, and perhaps even premature loss of the teeth. And then we've also got aesthetics, and that's aesthetics of the teeth and also aesthetics of the face. And we've heard already this afternoon about how important appearance is in today's society. We're all judged based on our facial, dental appearance all of the time, when we meet new people, when we're in social situations, when we're at work. And there's absolutely no getting away from the fact that appearance is really important. And then we have the slightly less common reasons for doing this type of treatment. Sleep apnea. That's a condition where patients have problems breathing when they're asleep, and it means they have severe snoring and potentially life-threatening effects. And by repositioning the jaws, that can have really life-changing effects for them. And then also situations where people have had injuries, fractures to their jaw, that we've already heard about earlier on, and also congenital conditions like cleft lip and palate, we've also heard a little bit about. These patients are also treated in this way. But in association with all of these physical factors is quality of life, and I think this is going to be a theme through the whole afternoon. Patients have a really dramatic effect on their quality of life as a result of having these sorts of physical problems. And we also heard a little bit about qualitative research earlier on. We've recently done some qualitative research in our department where we interviewed patients and asked them about how these problems affected them in their everyday life. And I've just selected 2 quotes from this research that I'll just leave up there, and I'll leave you to just read those for a few moments, and just to think about how you might feel if it was you feeling like that every day of your life. And we have quite a lot of evidence now that we do improve the physical and the quality of life, psychosocial aspects, when we do this type of treatment. But NFORC has given us a whole new way of looking at this. We're now collecting data for the whole of the United Kingdom. It allows us to get a national picture of the benefits that we're actually producing for our patients. And in doing that, it allows us also to make sure that we're producing the best possible outcomes for the patient in the best possible environment. And only by doing national research can we really achieve that. And that's something that we've not really been able to do at any stage in the past. So we wanted to just give you a little snapshot of the sorts of results that we get from treatment. You're going to hear from Graham in just a few moments. Graham's going to tell you a little bit about how he felt when he first came in asking for treatment. And he's going to tell you a little bit about how it's affected his life and what he's done in his life since having completed his treatment some years ago now. Here you can see the completely opposite type of bite, a patient with a very protrusive lower jaw, where the patient couldn't actually get his teeth together, difficulties biting and chewing, the same things that I talked about just a few moments ago. And then at the end of treatment, you can see that the patient has got a great bite, he can bite and chew the things he wants to do, he's got a fantastic smile and a really nicely balanced facial profile, and hopefully achieve that good quality of life that we're aiming for all of our patients.
Okay, this is just one of my patients. She first presented quite young, actually, one of the younger patients I treated. From a very, very early age, she was really quite unhappy about the way her teeth was and about her face. And I think you can see from the bottom picture that really she's going to obviously have problems with eating. So she underwent the treatment protocol that Professor Cunningham mentioned. She had braces to correct her teeth, put them in the right position. She then had jaw surgery. We brought her upper jaw forward, her lower jaw went back. And one can see she has a much more sort of balanced face and a really, nice dental outcome. She used to be quite a quiet, subdued individual. And I have to say now, I get quite a nice lot of pictures from her telling me that she's now at university having a great time. She's really confident and really enjoying life to the full, so it's really nice. I hope that's through with these series of individual patients, you get an idea of the sort of treatment outcomes that we can get with orthodontic treatment. That's important. However, we have to look at the bigger picture. And that's where NFORC has come in, as Sue mentioned. NFORC has actually surveyed nationwide patients who've had orthodontic treatment. And this is some of the results that they've got back. So on over 225 patients, they were asked, following orthodontic surgery, how satisfied are you? Following treatment with regards to your teeth and your face. And we can see that 99% of the patients who've had orthodontic surgery were happy. You can understand why. People don't want to have a asymmetrical face, jaws which are disproportionate. They don't want to have teeth that stick out or not being able to bite. So you can imagine when these issues are actually corrected by orthodontic treatment and surgery, they can actually move on. These patients can often be teased and bullied, and it's quite difficult for them. From a more functional point of view, in terms of eating, we can see that the study also found that over 90% of patients were more relaxed when they were eating in public. And we forget, eating as an activity is really important. From a social point of view, we eat with family, we eat with friends. Also, increasingly in the workplace, there are business lunches that are increasingly common. And patients feel embarrassed, in business lunches, having to sort of tear the food from their back teeth. It's just embarrassing for them. So this type of treatment can actually affect them socially, as also improving their sort of work situation as well. The personal relationships, well, that's always quite a complex sort of issue, but around 80% of our patients following jaw surgery felt that the personal relationship were also improved. And that's quite a complex thing. Is it because they felt better about themselves? Is it because the treatment they've undergone has made them become more sort of average? Because, average values, they don't stick out anymore. People don't tend to, they just blend in. So perhaps, we don't know. We don't really know why their personal relationship, but it must be multifactorial. I think probably this slide is the most striking result. 98% of our patients have reported that following orthodontic treatment, they're more confident. And certainly we get so many reports of patients who then tell us that following their treatment, they've actually done better in their work. They've gone for that job interview that they didn't want to go for before. They've gone for that promotion. They've done better at their education. Well, the braces and the surgery certainly hasn't changed their ability, but perhaps it's that they feel better about themselves, and it's confidence which has allowed these patients to sort of go ahead and actually achieve their full potential. We hope that with what we've presented you can see that orthodontic treatment and jaw surgery is actually successful treatment. It's a treatment which has low risk and low costs. most of the patients that we treat are fairly young, so we're talking about in their late teens and their sort of early 20s. And therefore, these functional benefits, these psychosocial benefits, actually are with these patients for an awful long time. We have some information about sort of the cost-benefit ratio of this treatment in small series, and that would suggest that the cost benefits are probably better than a lot of other treatments which are carried out in the NHS. As sort of clinicians involved with patients who have orthodontic treatment, we know of the immense benefit that this type of surgery can give to patients. But, as I think one of our previously mentioned, there is only a certain pot of money. We are in a different financial situation, and therefore we do need more data. And I think this is where NFORC is going to come in. They're going to help us collate more data, which will allow us to work out, is this treatment good? Who is it best for? We're not going to be able to give it to everybody, but we're hopefully going to be able to provide it to those patients who most need it, and it's going to be hopefully available or continue to be available on the NHS.
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organize research to improve patient treatment worldwide. Well done, Saving Faces.